Well, why should anyone, especially medical students, care about the pharmacology of uterine stimulants and relaxants? The answer is simple, yet profound. It all boils down to the essential role these medications play in one of the most significant events in human life, childbirth. Pharmacology, the study of how drugs interact with the human body, is a critical component of obstetric care. Obstetrics, the medical specialty focused on pregnancy, childbirth, and the postpartum period, often necessitates the use of medications that can either stimulate or relax the uterus. These uterine stimulants, also known as oxytocics, are drugs used to induce or augment labor, to manage postpartum hemorrhage, and even to perform therapeutic abortions. They work by increasing the frequency, strength, or duration of uterine contractions. On the other hand, uterine relaxants, or tocolytics, do the opposite. They inhibit contractions, and they're used to manage preterm labor, giving the baby more time to develop in the womb. But why is it so important to understand these drugs? The answer lies in the balance. The right use of these medications can be a lifesaver, aiding in safe and successful childbirth. However, the misuse or overuse can lead to complications, such as uterine rupture or neonatal respiratory distress. Knowledge about these drugs isn't just about knowing their names or what they do. It's about understanding their mechanisms of action, the appropriate dosages, the potential side effects, and the contraindications. It's about knowing when to use them, how to use them, and perhaps most importantly, when not to use them. So for medical students, this isn't just another topic to study. It's a critical piece of knowledge that can make a significant difference in their practice. And for the rest of us, it's a glimpse into the intricate world of medicine that works tirelessly behind the scenes of every childbirth. So, understanding the pharmacology of uterine stimulants and relaxants can be a game changer in obstetric care. It's time to dive into the details. What exactly are uterine stimulants and why are they used? This is a question that often pops up in the minds of those studying or practicing in the realm of pharmacology and obstetrics. Uterine stimulants, also known as oxytocics, are a group of drugs designed to stimulate contractions in the uterus. Picture this. The uterus is a muscular organ that needs to contract and relax in a coordinated manner to enable childbirth. Sometimes, due to various reasons, this process might need a nudge, a boost if you will. And this is where uterine stimulants come into play. These drugs are primarily used for two critical purposes: to induce labor and to control postpartum bleeding. In the case of labor induction, uterine stimulants can be employed when labor isn't progressing naturally, or if it's considered safer for the baby to be delivered sooner rather than later. On the other hand, postpartum bleeding or hemorrhage is a serious complication that can occur after childbirth. It's often due to the uterus failing to contract properly after the delivery, and this is where uterine stimulants can be a lifesaver, helping to contract the uterus and reduce blood loss. Now let's talk about some commonly used uterine stimulants. Oxytocin, a hormone naturally produced in the body, is one of the most commonly used uterine stimulants. It's often given intravenously to start or augment labor contractions. Then we have prostaglandins, another type of uterine stimulant. They are substances that the body naturally produces, but can also be synthetically made and used to ripen the cervix or induce labor. Misoprostol and dinoprostone are examples of synthetic prostaglandins used in obstetric practice. So, there we have it. A quick dive into the world of uterine stimulants. They're not just drugs, but crucial tools that play a pivotal role in the miracle of childbirth and ensuring the safety of both mother and baby. Now that we know what uterine stimulants are and their importance, let's understand their opposite counterparts, the uterine relaxants. What are uterine relaxants and when do we need them? Let's dive right in. Uterine relaxants, also known as tocolytics, are medications designed to suppress contractions of the uterus. They play a pivotal role in cases where there's a risk of preterm labor. That is, when the contractions begin before the 37th week of pregnancy. Imagine this scenario. A woman is in her 6th month of pregnancy and she begins to experience contractions. This is a critical situation because the baby hasn't fully developed yet. Here's where uterine relaxants come into play. By suppressing these premature contractions, the mother can carry the baby for a longer duration, giving the baby the much-needed time to develop further. Commonly used uterine relaxants include drugs like magnesium sulfate and nifedipine. Magnesium sulfate, a mineral that occurs naturally in the body, is often used as a tocolytic. It works by blocking the action of calcium on the muscle cells in the uterus, thereby preventing contractions. On the other hand, we have nifedipine, a type of drug known as a calcium channel blocker. It works in a similar fashion to magnesium sulfate by inhibiting the flow of calcium ions into the muscle cells of the uterus, thus preventing contractions. In essence, both magnesium sulfate and nifedipine work towards the same goal, that is, to delay delivery and buy time for the administration of steroids to speed up the baby's lung development. It's important to note that these drugs are not without their side effects, and their use needs to be carefully monitored by a healthcare professional. So, to sum up, uterine relaxants are crucial medications used in obstetrics to prevent preterm labor. They work by suppressing contractions of the uterus, giving the baby more time to develop in the womb. Next time you hear about magnesium sulfate or nifedipine, remember they are the superheroes that help in delivering healthier babies. Understanding the what and why of uterine relaxants and stimulants is crucial. But how do these drugs work? Let's unravel the mystery. How do these drugs, uterine stimulants and relaxants, work? Now that's the question we've been building up to. Let's dive right in. Uterine stimulants, also known as oxytocics, are drugs that increase the contractions of the uterus. They essentially amplify the natural process of labor. This is achieved through various mechanisms. Some of these drugs mimic the action of oxytocin, a hormone our bodies naturally produce during childbirth to stimulate uterine contractions. Others work by increasing the sensitivity of the uterus to this hormone, effectively boosting the body's own efforts. On the other hand, we have uterine relaxants, or tocolytics. Their job is to do the opposite. They decrease contractions. This can be critical in situations where we need to delay preterm labor for as long as possible. Tocolytics work in a variety of ways too. Some inhibit the production of substances that promote contractions, while others block the action of hormones that stimulate contractions. Some even relax the smooth muscles of the uterus directly. Now it's worth noting that these drugs don't work in isolation. They interact with the body's own hormones and systems in a delicate dance. It's all about balance. Too much stimulation can lead to excessive contractions, potentially causing distress to the baby, while too much relaxation can delay labor unnecessarily. And just like that, we've navigated the complex world of uterine pharmacology. Drugs that act on the uterus, both stimulants and relaxants, have their unique ways of influencing the ebb and flow of contractions. They work with the body, enhancing or dampening its own processes to facilitate or delay labor as needed. Knowing how these drugs work can make a difference in clinical decisions, but let's not forget to recap what we've learned. So, stay tuned as we wrap things up in the next segment. And remember, the more we understand, the better we can apply our knowledge to real-life scenarios. Let's take a moment to recap and consolidate our understanding. We've delved into the fascinating world of drugs acting on the uterus, focusing on uterine stimulants and relaxants. We've seen how these drugs play a crucial role in obstetric pharmacology, influencing the course of labor and addressing various uterine disorders. Uterine stimulants, or oxytocics, are employed to induce or augment labor. They mimic the action of oxytocin, the hormone naturally released by the body during childbirth to stimulate uterine contractions. Notable examples include pitocin and syntocinon, synthetic forms of oxytocin, and ergot alkaloids like methergine that act on smooth muscle cells to induce contraction. Conversely, uterine relaxants, or tocolytics, are used to delay preterm labor, giving the fetus more time to develop in the womb. These include drugs like nifedipine, which blocks calcium channels to relax the uterine muscle, and terbutaline, a beta-2 adrenergic agonist that inhibits uterine contractions. We've also explored the mechanisms of action of these drugs. Oxytocics bind to oxytocin receptors on the uterine muscle, increasing intracellular calcium levels and triggering contractions. Tocolytics, on the other hand, work by various mechanisms to decrease the calcium available for muscle contraction, thereby relaxing the uterus. In essence, these drugs work in harmony, each with its unique role, to ensure the safe and successful conclusion of pregnancy. They guide the delicate dance of uterine contraction and relaxation, facilitating childbirth or delaying it when necessary. Understanding the pharmacology of these drugs empowers healthcare professionals to make informed decisions in managing labor and treating uterine disorders. It's a testament to the power of pharmacology in improving health outcomes and saving lives. With a firm grasp on the pharmacology of uterine stimulants and relaxants, you're now equipped to make informed clinical decisions. Don't forget to subscribe for more because you won't find me later.